So now there are some developmental aspects of the skeleton. We'll start with the fetal skull. The fetal and the infant skull have fontanelles, and fontanelles are unossified spaces between bones in the fetal and the infant skull. And so you can see in the images there what the fontanelles actually look like. The fontanelles allow bones to move and overlap during childbirth. So that is a benefit for the mother. And then it also allows for brain development and growth for the infant. So that is definitely the benefit for the infant. Fontanelles will ossify between the ages of 1 and 2. You don't want them closing or ossifying before then, because then you are sacrificing brain development. My cousin, when he was a baby, they noticed that his fontanelles were starting to ossify too quickly. And so he ended up having to have surgery where they ended up exposing his skull and putting some spacers in between to prevent them from closing up, because had they closed up too early, his brain would not have had the space it needed to grow, because our brain grows the most, at least in terms of size, in those first 2 years of life. So you can see and feel these fontanelles or these spaces in an infant, because these are what we call the soft spots on the top of their heads. And so there's actually multiple places. And so you can actually feel that there is a soft spot there where there's not a bony protective area there. So you need to be very careful, because otherwise you could easily damage the infant's brain. So because they are separate, they are able to shift and move during childbirth. And sometimes an infant is going to be born with a very misshapen head. Within a few days to a couple of weeks, that will go back to normal size, because those bones can then reshift to their normal locations. So this is just kind of showing a timeline of the fontanelles and how they will eventually close. This is a YouTube video that you can watch where it actually shows the pulsation of the fontanelle. Because there's not a bony covering there, you can actually see the infant's pulse through that spot. Growth rates are varied as we grow. The cranium is huge relative to the face at birth. So we have a huge area for the cranium to house the brain, and the face is very, very tiny. And compare that to an adult skull where the cranium is still large, but we haven't seen much growth in that area of the skull. Most of the growth of the skull happens in the face area. And so we see that lengthen with age. And that's why, especially when we look at children that are like 8, 9, 10, and then we see huge changes in their appearance in their preteens and early teens, it's because during that time we're seeing lots of facial bone growth, and it can really change how a child ends up looking because of those massive changes in their skull. And this is just comparing newborn to adult skull and how it changes over time. Body proportions also change as we grow. So we do not have the same proportions as an infant that we do as an adult. That's because different parts of the body grow at different rates. So we already know that the facial bones are growing much more rapidly than the cranial bones. The arms and the legs also move much or grow much more rapidly than the other parts of the body. Body proportions change as we grow from an embryo. The head of a baby is about 25% of their body length, whereas an adult, it's only about 13%. The newborn baby's lower limbs are 33% of their body length, whereas as an adult, that's close to half of our body length. So if you look at a newborn raise their arms, oftentimes they don't even go over their head. And then if you look as you grow and develop, eventually your arms are huge. So right there, you can see in a quick snapshot how the growth rates for different parts of the body are very different and how the proportions of a newborn compared to adult are extremely different as well. Number of bones. So we know as an adult, we have about 206 bones. Newborns have over 300. And that's because if we count all of the different individual bones, um, we're going to see many more. And then we know that we have bones that fuse over time. And so then that will cause the count to be less in an adult. We've talked a little bit about the curvatures already. Primary curvatures, the thoracic and the sacral, we're born with those, and that gives us a C-shaped spine when we're first born. Secondary curvatures, the cervical and the lumbar, develop due to changes in the intervertebral discs. Lifting the head causes that curvature and causes a change in those intervertebral discs in the cervical region. Walking will cause changes in the intervertebral discs in the lumbar region. Potentially, if an individual never learned how to lift their head or never learned how to walk, their spine would continue to have that C shape with only the primary curvatures rather than having those secondary curvatures develop as well. There are some abnormal spinal curvatures. Scoliosis is one that oftentimes you're tested for when you're in elementary school, because this is one that seems to develop throughout preteen, early adolescence, teenage years. And this is when the spine develops a C or an S shaped curve. Um, if it's minor, it might just be monitored. If it is a major curvature, then it's going to require brace wearing and it could even require surgery. Kyphosis is an abnormally rounded upper back. We see this in individuals with osteoporosis where their vertebrae cannot support the weight of their head and the weight of their body. And so we see that abnormal rounded curvature. Lordosis is a significant inward curvature of the lumbar region. Um, we see this oftentimes in pregnant women where they end up having an extra significant inward curve to compensate for the extra weight that they're gaining during the pregnancy and they're changing center of balance. Individuals who are overweight might also have this exaggerated curvature as well. Old age, your bones will start to lose mass, and that has a lot to do with the connective tissues of our body losing some of their water content. So the collagen in the bones, as it loses water content, becomes less flexible. So the bones become more rigid. Ligaments and tendons, the collagen in those also lose water, become less flexible, and that can cause joint problems. So you might be more at risk of breaks in the bones, of dislocations or other joint problems. Intervertebral discs will also lose water content. They thin and they lose elasticity, which can cause a risk of disc herniation and also a possible loss of stature, meaning that you seem to get shorter as you get older. And so that's because the intervertebral discs flatten, which means that your height actually shortens. Even someone at your age, you might notice a change in the size of the intervertebral discs. When you first wake up in the morning, you are taller than you are when you go to bed at night. And that's because standing upright all day with gravity affecting your body, it causes those discs to flatten out somewhat. So your height will differ throughout the day. But when we talk about this loss of stature as you age, that is going to be more permanent. The costal cartilage begins to ossify, and so it makes the rib cage more rigid, and so it makes breathing more difficult because it doesn't have that flexibility.